If you're over the age of 60 and you've been dealing with sciatica pain that keeps coming back, there's something important you need to understand. Because the pain you feel may not be coming from where you think it is. Most people are told the same thing. It's your disc. It's your spine. Just stretch more, and it will improve. And for a while, it might. The pain eases. The pressure reduces. You feel some relief. But then, it comes back. Sometimes the same day. Sometimes the next morning. And over time, that cycle becomes exhausting. You stretch. You rest. You try different exercises. But the problem never fully goes away. And this is where most people get stuck, because they are treating the symptom, but not the cause. Let me tell you about something I've seen many times. A 68-year-old patient who had been dealing with sciatica for years. He had tried everything: stretching routines, pain medications, physical therapy, and each one gave him temporary relief, but nothing lasted, because the real issue was never properly addressed. And that's the part most people are never told, because in many cases, sciatica is not just a mechanical problem. It's not just pressure on a nerve. It can be something happening deeper, something affecting the strength of your connective tissue and the health of your nerves themselves. And when that happens, no amount of stretching can fully solve it, because you're trying to relieve pressure on a system that has already become weak. In this video, I'm going to show you a different way to look at sciatica, a way that focuses on what's actually happening inside your body, and why some people are able to feel real relief much faster than expected. My name is Darius Coleman, and if you want clear, honest guidance designed specifically for seniors, take a moment to like this video and subscribe to the channel, because understanding your body is the first step toward fixing it. Why sciatica keeps coming back after 60. Before we talk about how to relieve sciatica quickly, we need to understand something far more important. Why does the pain keep coming back? Because most people are not dealing with a one-time injury. They are dealing with a pattern that slowly develops over time and becomes more noticeable after the age of 60. Let's start with what you've probably already been told. Sciatica happens when the sciatic nerve becomes irritated or compressed. This nerve runs from your lower back, through your hips, and down each leg. It is the longest nerve in your body. And when something puts pressure on it, you feel it. Sometimes as sharp pain, sometimes as burning, sometimes as numbness, or a deep aching sensation. Now, in many cases, this pressure is linked to the disc. The disc sits between the bones of your spine. It acts like a cushion. And when that disc becomes weak or begins to bulge, it can press against the nerve roots. That pressure creates the symptoms we call sciatica. But here's the part most people never stop to question. Why does the disc become weak in the first place? Because discs do not suddenly fail overnight. They change gradually. And that change is often influenced by something deeper than just movement or posture, especially after 60. As we age, the structure of our body begins to shift. Connective tissue becomes less resilient. Collagen production decreases. The ability of the body to repair small damage becomes slower. And this is where the problem begins. Because your discs are not just mechanical structures. They are made largely of connective tissue. And that connective tissue depends on nutrients, minerals, and proper cellular function. When those factors are not optimal, the structure begins to weaken, not dramatically, but slowly. The outer layer of the disc becomes less stable, less able to hold its shape under pressure. And over time, that weakness allows the inner portion to push outward, creating the bulge, creating the pressure, creating the pain. Now here's where things become more interesting, because the nerve itself is also affected. The sciatic nerve is not just a cable. It is a living structure. It requires nutrients. It depends on proper signaling. It is protected by a layer called myelin, which helps signals travel smoothly. And when the body is not receiving what it needs, that protection can weaken. The nerve becomes more sensitive, more reactive, more likely to send pain signals, even under mild pressure. So now, you have two things happening at the same time: a structure that is becoming weaker, and a nerve that is becoming more sensitive. And together, they create a cycle. Even a small amount of pressure feels stronger. Even a minor movement triggers discomfort. And this is why stretching alone often fails, because stretching addresses the pressure, but not the condition of the tissue itself. It creates temporary relief, but it does not change the underlying structure. So the pain returns again and again. And this is what many people experience. They feel better after stretching. They think the problem is improving. But by the next day, the pain is back, because the root cause has not changed. Now there is something else to consider. After the age of 60, the body's ability to absorb nutrients also changes. Digestion becomes less efficient. Stomach acid levels decrease, and this directly affects how well your body absorbs essential minerals. Even if your diet looks good on the surface, your body may not be receiving what it needs at a cellular level. And when that happens, the tissues that depend on those nutrients begin to weaken, slowly, quietly, over time. This is why some people develop recurring sciatica without any major injury. No fall, no accident, no clear trigger, just a gradual increase in discomfort. Because the system itself is changing, not in one place, but across multiple levels: structure, nerve function, repair capacity. And unless all of these are considered, the problem continues. This is not about creating concern. It's about understanding. Because once you understand why the pain keeps returning, you stop chasing temporary fixes, and you begin to look at what actually supports the body. In the next part, we're going to go deeper, because there is a specific hidden factor, something most people are never tested for, that may be directly affecting both your connective tissue and your nerves. And once you understand that connection, the entire picture begins to change. The hidden cause. Most doctors never check. Now that you understand why sciatica keeps coming back, we need to look at something deeper, something most people are never told, and more importantly, something most doctors never test for. Because in many cases, sciatica is not just a structural problem. It's not only about discs or posture or how you move. It can be influenced by something far less obvious, a deficiency, not a major one, not something that shows up clearly in basic tests, but something that quietly affects how your body builds, repairs, and protects itself. Let's talk about copper, a trace mineral, often overlooked, rarely discussed, and yet deeply involved in how your body maintains connective tissue and nerve function. Now this may sound surprising, because when people think about sciatica, they think about pressure, but they don't think about what allows the body to resist that pressure. They don't think about what gives your discs their strength, or what allows your nerves to function properly. Copper plays a role in both. Let me explain. Your spinal discs are not just mechanical cushions. They are made largely from collagen. And collagen is not something your body produces automatically in perfect amounts. It requires support. It requires specific nutrients to form properly. And one of those key nutrients is copper. Copper acts as a cofactor in enzymes that are directly involved in building and maintaining collagen. Without enough copper, the structure becomes weaker, not instantly, but gradually. The outer layer of the disc loses its integrity. It becomes more vulnerable to pressure, more likely to bulge or shift. And when that happens, the sciatic nerve is affected. But that's only one side of the problem, because copper also plays a role in the nervous system itself. Your nerves are covered in a protective layer called myelin. This layer helps signals travel smoothly and efficiently. Without it, nerve signals become disrupted, slower, less controlled, and sometimes more painful. Copper is involved in maintaining that protective layer. It supports the enzymes that help keep nerve function stable. So when copper levels drop, two things begin to happen at the same time. Your connective tissue becomes weaker, and your nerves become more sensitive. That combination creates the perfect conditions for recurring pain, even if the original issue was minor. Now here's the part that most people never consider. Copper deficiency does not always look obvious. You may not feel deficient. You may not have clear symptoms that point directly to it, because the effects are spread across different systems. A little weakness in connective tissue, a little increase in nerve sensitivity, a slower recovery process. Individually, these changes seem small, but together, they create a pattern that shows up as recurring sciatica. Now the question becomes, why would someone become deficient in copper? And the answer is not always simple. It can be diet. Foods rich in copper, like organ meats or shellfish, are not commonly eaten. It can be imbalance. High intake of other minerals, like zinc or iron, can reduce copper levels. It can be absorption. As we age, the body becomes less efficient at absorbing nutrients, even if they are present in the diet. It can also be lifestyle, stress, poor sleep, long-term medication use. All of these can gradually affect how your body uses and maintains essential minerals. And over time, those small changes begin to matter, because your body is constantly rebuilding itself. And if it does not have the materials it needs, the quality of that rebuilding process declines. Now think about what this means. If your disc is weaker and your nerve is more sensitive, then even normal movement can trigger pain. Even small pressure can feel significant, and no amount of stretching can fully solve that, because the issue is no longer just mechanical. It is biological. It is structural. It is internal. This is why some people try everything and still don't find lasting relief, because they are addressing the outside, but not the inside. And until that balance is restored, the cycle continues. In the next part, we're going to look at something very important: the signals your body may already be giving you that this process is happening. Because in many cases, the warning signs are already there. They're just being overlooked. The warning signs your body is already showing. By now, you understand something most people never realize: that sciatica is not always just about pressure on a nerve. It can be influenced by something deeper, something that affects both the strength of your connective tissue and the sensitivity of your nerves. But here's the part that makes this difficult. This process does not begin with a clear signal. It doesn't start with severe pain. It doesn't suddenly stop you in your tracks. Instead, it begins quietly, with small changes, subtle signs, the kind that are easy to ignore and even easier to explain away. And yet, these are often the earliest warnings your body gives. Let's start with something very common: a feeling that the pain comes and goes without a clear reason. Some days, it feels manageable. Other days, it returns suddenly. You didn't lift anything heavy. You didn't move the wrong way. And yet, the discomfort is there. This is often one of the first signs that the issue is not purely mechanical, because mechanical problems usually follow a pattern. But when the pain appears inconsistently, it suggests that the system itself is becoming more sensitive. Another sign is how quickly the pain returns after temporary relief. You stretch, you feel better, but within hours, or by the next day, the pain is back. This cycle can continue for weeks, even months, and over time, it becomes frustrating, because it feels like you're doing the right things, but nothing lasts. This is often a sign that the underlying tissue is not recovering, that the body is not rebuilding itself as effectively as it should. And without that repair, the same problem keeps repeating. There are also changes in how the pain feels. In the beginning, it may be sharp, localized, easy to identify, but over time, it can become more diffuse, more spread out: a burning sensation traveling down the leg, or a numbness that comes and goes. Sometimes even a deep, irritating ache that is difficult to describe. This change in sensation often reflects something happening within the nerve itself. Not just pressure, but sensitivity, a nerve that is reacting more strongly than it used to. There are also signs that go beyond the pain itself. A feeling of weakness in the leg, not severe, but noticeable. You may feel less stable when walking, less confident when standing for long periods, almost as if the connection between your muscles and your movement is not as strong as it once was. This is not always obvious, but it becomes more noticeable over time, especially in people over 60. Because as nerve function changes, the communication between the brain and muscles can become less efficient, and that affects stability. There is also something else many people overlook: slower recovery. You may notice that it takes longer to feel better after a flare-up. What used to improve in a day now takes several days or longer. This is not just about the injury. It's about the body's ability to repair. And when that ability is reduced, healing becomes slower, less complete, and more temporary. Another sign is sensitivity to small movements. Things that never caused pain before now begin to trigger discomfort. Sitting for too long, standing in one position, even minor adjustments in posture. This suggests that the system is becoming less tolerant, that the margin for error is getting smaller. And this is often where people feel confused, because they believe the problem is getting worse, even though they are being more careful. But the truth is, it's not just the movement. It's how the body is responding to that movement. And when the internal structure is weakened, even normal activity can feel like strain. Now here's the important part. None of these signs, on their own, may seem serious. They are small, manageable, easy to live with. But when they begin to appear together, when the pattern becomes consistent, that's when they matter. Because the body is not sending random signals. It is showing you a pattern that reflects what is happening beneath the surface. And the earlier you recognize that pattern, the easier it becomes to change it. Because once the structure is fully weakened and the nerve is fully irritated, the process becomes more difficult, more time-consuming, more complex. But at this stage, when the signs are still developing, there is still room to correct the direction. And that is the opportunity most people miss, not because they don't care, but because they don't see it. They don't recognize the connection between these small signals and the larger problem. In the next part, we're going to bring everything together. Not just what's happening, but what you can actually do about it. Because once you understand the cause and recognize the signs, the next step becomes clear. And more importantly, It becomes something you can start immediately. What actually helps you relieve sciatica the right way? By now, the picture is clear. This is not just a problem of movement. And it's not just about pressure on a nerve. It's about something deeper. The condition of your connective tissue, the health of your nerves, and the ability of your body to repair itself day after day. And once you understand that, the approach to relief begins to change. Because instead of chasing temporary comfort, you begin to support the system itself. So let's talk about what actually helps, not in theory, but in a way you can apply immediately. Step 1. Continue movement, but change the purpose. Most people are told to stretch, and stretching can help. It reduces pressure, it improves flexibility, it gives short-term relief. But the mistake is relying on it as the only solution. Because stretching does not rebuild tissue. It does not repair the disc, and it does not strengthen the nerve. So instead of stopping movement, you change your mindset. Stretching is not the cure, it is support. Something that keeps you comfortable, while your body works on healing underneath. Step 2. Support the structure from within. This is where real change begins. Because your body cannot repair what it does not have the resources to rebuild. And one of the most overlooked factors is mineral support, especially copper. Not as a trend, not as a quick fix, but as a necessary component for how your body functions. Copper plays a role in building collagen, and collagen is what gives your discs their strength. Without it, the outer layer becomes weaker, less able to hold its shape, more vulnerable to pressure. At the same time, copper supports the nervous system. It helps maintain the protective layer around nerves, which means signals travel more smoothly, less irritation, less sensitivity. Now, this does not mean you take large amounts immediately. It means you become aware of your intake. Foods that naturally contain copper, liver, shellfish, certain nuts, like cashews, dark chocolate without added sugar. These are not foods people eat regularly, and over time, that absence can matter. In some cases, supplementation may be considered. But the key is balance, because minerals work together. Too much of one can affect another. So the goal is not excess, it's restoration. Step 3. Reduce what is quietly depleting you. This is something most people never think about. It's not just what you lack, it's what is taking those nutrients away. Certain habits can slowly deplete minerals like copper. High sugar intake, excessive alcohol, too much processed food. Even large amounts of certain supplements, like zinc or synthetic vitamin C, can create imbalance over time. And this is where awareness becomes important, because you may be doing something every day that is quietly working against your recovery without realizing it. Step 4. Give your body time to repair. This is where expectations need to change, because healing is not immediate. It is not something that happens in a day or even a week. Collagen takes time to rebuild. Nerves take time to recover, and the body needs consistency to make that process happen. But here's the important part. When the right conditions are created, the body does begin to respond. Not suddenly, but gradually. Pain becomes less frequent. Flare-ups become less intense. Recovery becomes faster. And over time, the pattern begins to shift. Step 5. The 5-minute relief approach. Now here's where your title connects. Because yes, there are simple movements that can help you feel relief within minutes. But those movements work best when the system underneath is supported. A simple routine, gentle lower back stretch, slow leg extension, light movement of the hips, nothing aggressive, nothing forced, just controlled movement. That reduces pressure on the nerve. And when combined with internal support, that relief begins to last longer. Final thought. Most people spend years trying to fix sciatica by focusing only on what they feel. The pain, the discomfort, the limitation. But the real change happens when you focus on what is causing it, because the body is not working against you. It is responding to what it has and what it lacks. And when you begin to give it what it needs, the response changes, slowly, but consistently. So if there is one thing to remember, it's this. Relief is not just about removing pain. It's about restoring the system that created it. And sometimes, the solution is not another stretch, not another treatment, but something much simpler. Something your body has been missing all along.